choice. It was a real choice. I could decide to live in the village of Potsdam, or I could decide to live somewhere where I could, for example, drill a well and have a pump. Tonight we've heard a few people suggest that this is about freedom of choice. Well, I would submit to everybody in this room, especially to all of you, that we have had that freedom. It's called elections. And we have repeatedly revisited it through every single election. That is a basic democratic principle. And we haven't forced it on people. People have decided to live in a village that uses that democratic process. If you decide to vote against it, I would like you to ask yourself, how is it that I know, ignoring all of the expert opinion that we've heard, that all of the people who occupied your seats before you occupied that seat were wrong? And that, I think, is the fundamental issue. Thank you.
Thank you. Thank you. So, lady in the back.
Hi, my name is Laura Ettinger. I reside in the village of Potsdam with my spouse and 2 children, all of whom drink village water. And I support community water fluoridation. I am not a physician. I am not a scientist. And like I presume everyone in this room, I'm a critical thinker. So that means, with all apologies to the scientists and physicians in the room, I don't always just accept what a physician or scientist says as the gospel. However, in this case, all major public health organizations, World Health Organization, American Public Health Association, others that have been mentioned, strongly support this. And like Victor Kamania said earlier, I'm especially concerned, I'm in a privileged position. I could afford to do things to help my own children have access to fluoridation, but I am concerned about what we are doing to our community for the many people who do not seek dental care and cannot afford to make these so-called choices. I think it's essential that we continue community-wide water fluoridation. Thank you very much.
Thank you.
Hi, my name is Pedro Alvarez. I live in Lisbon. I've been practicing dentist at the Community Health Center in Canton since 1996. I just wanted to let you know that I personally have seen an increase in the number of caries since Canton started fluoridating the water in the Canton residents. I see many young kids come in after this few years after stopped, their teeth are just in terrible shape. I end up having to extract numerous teeth. And I see these not in the kids that come on a regular basis to get their treatment and get their fluoride treatment, but I see them the ones where the parents just call when the kid is in pain and have an emergency, because they don't routinely get dental treatment, they don't routinely get fluoride rinses, they don't routinely get toothpaste. And that's what I'm seeing is young kids that are suffering from really bad dental decay. So I'm with you.
Thank you. Let me ask somebody else. Anyone else wish to speak? Sir?
I'm Al Kadar. I'm a.
Come at this question by the podium.
She's standing.
By the podium.
Podium, okay. Here. Sorry I'm late. I apologize if I say anything that's redundant because I just got here a few minutes ago. I'm the county's rheumatologist. I'm Al Kadar. I wanted to speak just quickly about fluoride, both from a personal experience and also a little bit kind of broad strokes from my clinical experience. So I'm a specialist in autoimmune disease, and some of the effects that we see from tooth decay, and really, having fluoride in our water is the one best known public health measure we can take to prevent tooth decay. Everybody from the American Academy of Pediatrics to any major dental society will say the same thing. Beyond just the cosmetic impact of having no fluoride in the water is that there's also the issue of chronic inflammation, which good science has shown has been linked to everything from increased risk of cardiovascular disease, diabetes, various forms of inflammatory arthritis, the most notable being the one I see most commonly, rheumatoid arthritis, a disease which is now affecting about 1% of the population, and with worsened oral health is likely to affect more people. So the link between poor oral health and CCP positive RA, which is the most durable kind of RA diagnosis you can give, is very well established, and I'm happy to provide people with resources later if need be. So I wanted to just make light of that. It goes beyond the teeth, and people have probably already mentioned this, but I wanted to second that as well. Second is just a story I have for myself. I was a Peace Corps volunteer in the mid-90s in a little country called Tonga. No fluoride in the water. Just a 2-year experience, but before that I had never had a cavity or even come close to having a cavity. And within 2 years, I had several bad cavities that I had to have fixed when I came back to the US. So it was a one-time 24-month experience from my own life. Nothing else changed. I really didn't have, if anything, my diet improved because I had gone from being a college student, eating a terrible diet, to staying with homestay families and having a lot of vegetables and root crops and having actually a better diet. Overall, my brushing habits didn't change. It was a pretty good controlled experiment. All that changed was that I no longer had fluoride in my water, and it was a dramatic difference over just 2 years. And anybody who is a physician or healthcare provider in the community knows that poor oral health is rampant in our community. One final thing I'll say is I moved here from Seattle several years ago, and just the difference between a poor urban community and a poor rural community has been striking to me over the years. I pretty much always look at my patients' mouths, and the amount of patients who are completely edentulous, having no teeth at all, or are missing many, many teeth, and have severe tooth decay, it really is significantly higher here. No big data to stand on there, just one person's anecdotal experience, but I did want to share it today. So thank you.
Thank you. Anyone else?
I'm Tom French, I live in Missouri. Dr. Johnson talked about different backgrounds and how we have to trust people with different backgrounds. I'm an English teacher, and sometimes people come to me and they trust me to edit their stuff. My wife is an elementary guidance counselor, and more people go to her to ask for advice on how to raise their kids. As a teacher, I've seen kids in pain from tooth decay, and they sometimes are actually disruptive because of the pain they're experiencing. And sadly, there's no magic fix when they go to the nurse's office. Sometimes it can take weeks or months for people in poverty to find a solution to whatever medical problems they're having. And I have seen that. I don't know whether the kids in Messina, where I work, some of them are probably getting fluoridated water within the village, but many of those kids are not. I have 2 kids, they're both in their teens, and they've never had cavities, and they were born and raised right here in Potsdam. I was born in an area without fluoridated water, and I definitely had cavities growing up. So I think the anecdotal evidence from my side, and maybe it's because my wife is such a good parent and people are looking for advice, and she knows to have kids brush their teeth every day. It couldn't have been me. But I would also suggest that it's probably because of the fluoridation. Thank you.
Thank you. Anyone else?
Hi, folks. My name's Stephen Bird. I live on 14 Missouri. I've been here for about 10 years. So I'm a resident, and I also teach public policy. And primarily, I focus on science, technology, and public policy, and energy policy. And I do a lot of work in public policy on something called precautionary principle. So one of the things that the precautionary principle teaches us is that we should be skeptical of science and careful with science, particularly about long-term potential effects. The challenge here is that when you have a set of established evidence and many, many, many peer-reviewed studies and a degree of plurality, right, a degree of consensus among scientists that you have a very powerful positive effect, and extraordinarily limited evidence that there are problems or concerns, at that point in time, as a general rule, what we look for in public policy is to move forward on the basis of the consensus of scientific evidence, right? Until we start to see some degree of concern in serious peer-reviewed research that there is a problem and that it's serious. And that, at that point in time, right, if you're being cautious, you look to that. we have no sign of that. So we have some small studies, right, mostly focused on dosage and a few other issues. But there's no strong evidence that there's a significant public health problem occurring in the way that fluoridation is implemented the way it is here in the United States, right? And so that is what I would encourage the board to consider, right? Enormous benefits here, a long-term record, and very, very little, right? If there is a real concern, there's going to be a whole host of folks working in universities, my colleagues here at Clarkson, at SLU, and across the United States, focused on this issue and trying to unpack it, right? That's what we look for. That's how we found out about the Flint water crisis, right? Because scientists care to start taking a look at it. So right now, we just do not have significant evidence that is telling us we need to be careful. And we do have long-term, serious, scientifically reviewed peer evidence that is very, very strong. Thanks.
Thank you. Anyone else? Keep it short, please.
Of course. The FDA has not approved fluoride for human consumption. There's a reason for that. There are many academies that do not approve of it, or they don't. It's not that they don't approve of it, they just take no position, including the kidney. Can't remember the exact name of it, but the National Kidney Association, that changed to no position from pro-fluoride because it does affect people with kidney disease. That much is very clear. The National Academies of Science did an extensive review in 2005 or 2006. I have the link of fluoride on all 7 physiological systems of the body. Every one of them, the recommendations says, we don't know enough. There are actually many studies that have been done that say that fluoride does have negative health consequences for people who are above 10 years old. So, I would ask the Board of Trustees to look into that. And I will look into this further for you, but I would ask that you look into this increase in dental caries in Canton. I tried to find the opposite, and I could find nothing that could tell me that. Where is this study? Give me some evidence. There is no evidence to this. And if you can find it, anybody can find it, please let's bring it forward, because if that's true, well, I'm amazed, and I'll stand back on that. But and the other thing is, it's a little disingenuous to say that every one of you guys and all of your predecessors have voted for fluoride in the past and now you're stomping on them. How often has this come up for a vote in the Board of Trustees? I believe this is once in 35 years. So you are not stepping on your predecessors. That's just very disingenuous to say. That's about it.
Okay, thank you.
Thank you.
Johnny Johnson again, just a quick, give a couple of answers. The Food and Drug Administration does allow fluoride to be added to bottled water for prevention of cavities. It is at 0.7 parts per million. It says on the back of the bottle that is added to help prevent cavities. You can purchase it that way. The FDA has control over food and drugs. Bottled water is considered a food. Tap water is controlled by the American Environmental Protection Agency, very strictly controlled. Bottled water, it usually comes out of a hose at whatever factory they have it at. And so it's God's honest truth, they can have from no fluoride in it to up to twice as much fluoride. Arrowhead has 1.4 parts per million of fluoride in it. It's not labeled on the bottle, doesn't have to be. So most bottled water doesn't have it, but San Pellegrino, 0.45 parts per million. So you don't know what you're getting, and it's not as healthy and safe, it's not as healthy and safe as tap water. The second thing she referred to was a 2006 National Research Council's evaluation of the EPA's standard of how much fluoride can be in our water without causing physical harm. We have 200,000 people living in the United States that are drinking water above 4 parts per million. That's 6 times what your water is, has it at 0.7. This was a group had met for 3.5 years, non-paid, debated, and there were 3 anti-fluoridationists on it. Their final analysis was the only thing that happened at 4 parts per million was the brown stain I showed you. At 2 parts per million, that went away. There were no health issues, no IQ issues, no cancers, no reproductive issues, no gastrointestinal. And you go through here and cherry pick out little pieces of pages of it, that's what folks who are opposed to fluoridation do. But that 12-member group signed off on, there are no health issues except stained teeth at 4 parts per million, and at 2 parts per million went away. So I'm happy to go through this with you. I've read the book, I've talked to know people that are on the council, and just thank you for hearing me out on it. Thank you, sir.
Dean Lobster, 5 Lower Pine. I'm not a dentist. There's many dentists in this room. If I go to the dentist's office, they have to ask me if I want topically applied fluoridation, which I have no problem with. Topically applied, no problem. Toothpaste, I have no problem. But just like the school district does not have a fluoridation rinse program, we don't see all these health professionals clamoring and asking why this is not so, because that's where all these poor children would probably be able to acquire fluoridation. Okay, they took it out many years ago, but nobody was showed up in fluoride shirts. I love fluoride protesting. We don't see them clamoring over in Canton to put the fluoridation, the hexahydrofluorosilicic acid, a silica fluoride, a known neurotoxin identified by the Lancet peer-reviewed medical journal, forcing me to ingest the hexafluorosilicic acid. So it is a freedom of choice. This is my body, my wife. You know, it is a known endocrine disruptor. It disrupts the thyroid, displacing iodine, evidently. My wife is hypothyroid. And one of the reasons why I started, a few years ago, I approached the board. There were lead letters sent home, elevated lead letters sent home to Potsdam Central School District homes, stating that there's elevated lead levels in the schools at different faucets. In 2016, the New York State mandated that all schools be tested for lead. So they sent letters home November, December of 2016, Potsdam Central School District, that there's elevated lead levels. Hexafluorosilicic acid is a known bleaching agent of lead and brass fittings. So we have no idea in the rest of these our homes, which are older, businesses, if there's lead being bleached. The CDC says there is 0 tolerance for lead in children. That's what started this whole thing, by the way. And then the fact that they need a new fluoridation system. So I'm going to end there, but I do want to thank you, Mayor Tischler, Trustee Lee, Administrator Thompson, for meeting with the mayor of Walden, and the trustee, Lynn Thompson. Mayor Susan Rumble was a 26-year office manager of a dentist's office who the dentist opposes fluoridation. And Lynn Thompson is a 33-year pediatric nurse, retired nurse. And also want to thank you, Trustee Ward and Mayor Tischler, for attending the fluoridation presentation. I invited many dentists that are in attendance this evening and health officials to attend those meetings, but not one of them would show up. So, and I have no problem with the dentists here or health officials. I'm opposed to the ingesting of fluoridation. Thank you.
Thank you. Anyone else?
So my name's Andrew Williams. I'm a resident in the village of Potsdam. I live on 5 Missouri Ave. I want to thank you guys for listening to public comment tonight. I know it's been a long evening. I want to just emphasize a couple of points and then address a couple of issues, a couple of questions that were brought up. I am a physician, but I'm also a critical thinker. I'm very careful about anything that I recommend to my patients or anything I ingest as an individual and also as a parent. I think if you carefully review the literature that's available on this issue, published both in this country and in other countries, it's very clear that community water fluoridation is effective at preventing tooth decay, which, as was pointed out, is the most common childhood illness, which can lead to serious morbidity and also even death. It's cost effective. Not having community water fluoridation is often considered a hidden tax on a community. So people who don't have community water fluoridation end up paying out of pocket or end up paying more to the state because Medicaid spending on dentistry goes up so much. The third thing is it's safe. There's tons of literature on this. It's been used for 70 years. I think the evidence is very clear on this point. As the medical director of the community health center, and 3 of our dentists are here, I can tell you that access to dental care for people who have Medicaid, or also for the working poor who don't have dental insurance and don't have Medicaid, is a huge expense. If one child needs dental care, people are taking time off work, people are paying the out-of-pocket expenses, it's a huge issue. So disparities are prevalent in our community, and we need to make sure that we're taking care of those who can't always take care of themselves in the way they want to. But I want to address a couple specific issues. So talking about fluoride as though fluoride in the water, community water fluoridation as though it were a medicine, I think is very misleading. I think it's a choice of the anti-fluoride people to try and communicate in this way. Fluoride, if you take water and you look at it, the fluoride ion that was provided by our village versus the fluoride ion that's already present are identical, and you cannot tell the difference chemically or in any other measurement. We also add chlorine. We don't ask people for consent to chlorinate the water so that we prevent bacterial and parasitic infections. And as another aside, we supplement salt with iodine. We add vitamins to cereals to prevent spina bifida and other childhood illnesses. Concerning choice, if you take